Hey, I'm Kyle, and there's nothing I like better than hanging out in the house with my scrubs all day. Not really. Today I'm going to show you an abdominal assessment. This is my brother-in-law who has forcefully volunteered to do this. For time's sake, I've already washed, explained the procedure to the patient, and donned my gloves. I'm going to go ahead and do some subjective data. Sir, have you had any GI or bowel issues?
No.
Good appetite?
Yes.
Any abdominal or nausea?
No.
Pain?
No.
How are your bowel movements?
Good.
Are they regular?
Yes.
Are they formed?
Yes.
So we're going to drape the patient from the pubis to the nipple line. I'm going to start out with inspection. Patient is flat, he's symmetric, skin color is good, no palpation, and I'm going to shine my light across it, doing no shadowing to show any masses or bulbs. We're looking for hernia and kind of check out the umbilicus. There's no herniations or anything. So next I'm going to do auscultation. You can listen to 6 to 8 seconds each quadrant to see if the patient has bowel sounds. And the patient does have bowel sounds, and he could have hypoactive or hyperactive bowel sounds, or he could have no bowel sounds, which is very uncommon. You would want to listen for 5 minutes straight if you couldn't hear any bowel sounds to say the patient doesn't have any. Next, I'm going to listen for vascular, for any kind of swishes or bruits. I'll listen for the aorta, the renal, the iliac, and the femoral. This patient does not have any swishes or bruits. It wouldn't be very well if he had any. It could be stenosis, partial occlusion, or aneurysm of the arteries. Next, we're going to do percussion to detect any dullness in the abdomen. We're going to move in a clockwise pattern, a systematic pattern. He had tympany all through his abdomen. If he had any kind of dullness, it would kind of indicate fluid, enlarged organs, masses, full bladder. And then you can also detect the span of the liver by going the upper right quadrant, the mid-clavicular line. And then you can measure that out. And then you can also do the spleen in the mid-axillary line. Next, we're going to do palpation to check for size, location, and consistency of certain organs, also for tenderness, and search for masses on deep palpation. So, first of all, I'm going to do light palpation. Do clockwise, see if there's any tenderness in the abdomen. Then we're going to go deep. When you do that, it's going to be at least 1 centimeter on the light palpation. And then we're going to do deep palpation, which is about 5 to 8 centimeters. Look for any masses. Obviously, my patient is pretty ticklish. There's none. Next, we're going to see if we can feel some of the organs, palpate some of the organs. Normally, they won't be felt. We can kind of support underneath 12th rib here in the costal space and kind of take a deep breath, sir. Breathe in. You can feel the line, bumpy line of the liver. Cannot. You can also do the same thing with the spleen. And then use the duck-bill method to try and palpate the kidneys first on the right side, then on the left. And I'm not able to palpate any of them. Normally, you probably don't want to because that could be a cause of infection and swelling, inflammation. If you do happen to find any masses during deep palpation, you need to document them thoroughly. Normally doing like location, size, shape, consistency, mobility, if it has a pulse, and tenderness. Lastly, we're going to see if we can palpate the aorta, which is going to be just left to the umbilicus in the midline. Use your thumb and your 2 fingers. And I am able to palpate that. Lastly, we're going to percuss the costovertebral angle to see if there's any kind of kidney tenderness. Kind of around the 12th rib, the lower back on that angle. You're just going to take your hand, and then you're going to use the bottom of your hand and do a, and if he should feel nothing but a thump, if he has any kind of tenderness, he would let us know. And that is it.